A very exciting morning as far as vaccines are concerned. Just a few minutes ago, Heidi Jokos and I brought you the aircraft carrying 80,000 Johnson & Johnson vaccines. It has touched down safely. We saw the offloading of 5 pallets into the back of a refrigerated vehicle, which is going to a secure location. There's the visuals. That's the first vaccines that arrived in South Africa. The president was there for that. He's there checking the purchase order. He seems happy with it at the time. As well, the visuals we had from earlier today, not so much fanfare as far as government was concerned. It seemed a lot more low-key. So that was from a couple of weeks ago when the president and the deputy president were out. This morning, the Johnson & Johnson vaccines arriving. So let's talk about the campaign of the vaccines and rolling it out, shall we? I'm joined by South African Medical Association Vice-Chairperson, Mr. Mvuyisi Mzukwa, to share his thoughts on the vaccination process so far and also to respond to some doctors complaining regarding the inefficiency of the process. Mvuyisi, good morning to you. It's always a pleasure speaking to you. We'll talk about the doctors' complaints in a moment. They are valid, and I'm sure they want to hear from you. First of all, 80,000 more vaccines arriving this morning. Of course, it's good news. Some wonderful visuals of the national carrier carrying it for South Africa as well. But it's still just a drop in the ocean, isn't it? We're still very far off for phase 1, aren't we?
Gareth, thank you so much, and good morning to you and your viewers, and thanks for having me in this program. Gareth, we are happy that a vaccination program has started in South Africa, and we have joined other countries in the world. We really appreciate that, and we want to cooperate with government, in every endeavor that they on. But our challenge at the moment is that it looks like there is no clear, explanation to healthcare workers, as to how the other hospitals, in the institutions in those provinces were obviously selected, because there are those that feel that they should have been prioritized in terms of the number of conditions, or should I say COVID-19 cases that were handled by those institutions. So there's that uncertainty as to how it was done. So the other thing is the feeling that the private sector sidelined in terms of what is happening. I would talk about the specialists in the hospital groups. I would talk about those healthcare workers in rural areas and remote areas, that so far are in the dark when it comes to when are they going to be vaccinated. So I do think that there still are challenges in terms of, healthcare workers being taken on board. But the other challenge that we've noted was, the vaccination of non-patient-facing people in the hospitals. Administrative staff prioritized, in terms of getting a vaccine, and over those who are facing patients. And I think that is something that really needs to be looked into.
Let me ask you to stop there, Dr. Mzukwa. The reason I'm jumping is that the signal is a little bit iffy, so I do want to just get this question to you, I think, before perhaps we lose you on this. How would you advise government to do the rollout? There is a priority on the public health care system as well. We are hearing about this EVDS. For those who don't know what EVDS is, it's the electronic vaccination data system. It's the registration system to get yourself vaccinated. Where do you think government can make a change, Doctor, as of today, as you and I watched live visuals of the second batch of vaccines? What are you telling government to do to get it right?
What I would tell government to do is to, one, identify the stakeholders and, those front-line workers who are really facing patients. That's the first thing, whether those people are in the private or in the public. And when I deal with these cases, I would look at which hospitals, which institutions in the provinces were dealing with high cases or caseloads of patients. then I would attend to those first. You know, to be identifying hospitals because they've got big names, but they've got a small fraction of cases, it doesn't help. Also, I would make sure that those people who are in the remote areas are assured that they are going to get a vaccination, and there's a ongoing communication with those that are affected, and making sure that the EVDS as well is working well, because it has its challenges. You find that those who are in private are being rejected by the system if they don't put in the public hospitals or public institutions as their workplace. So those are the things that need to be fast-tracked. And also, you know, if the booking system is well, then we need to make sure that we don't just take in walk-ins. When we know that we're in a pandemic, we need social distancing.
I appreciate your time in speaking to us. Always a pleasure. From the SA Medical Association this morning, Dr. Mvuyisi Mzukwa.